our chair, Dr. G.N. Rao sir, to address this topic so that every one of us is enlightened. Thank you. Thank you very much.
Thank you so much. What I'd like to do is to split my talk. I have already sought the permission of the Dr. Harpreet Kaur to do that because myopia is the most critical component of refractive errors. And my colleague from LV Prasad, Pawan Verkicharla, is perhaps one of the most knowledgeable people in this field in the world. Research, clinical care. He happens to be the head of our myopia program at the Institute. So I'm splitting my time with him. What I'll do is a 7-minute broad overview about the uncorrected refractive error, and Pawan will talk for the next 8 minutes out of my 15 minutes allocated to me. So uncorrected refractive error by definition is a presenting visual acuity of less than 612 in the better eye. And all these different components, myopia, hyperopia, astigmatism, and presbyopia. And almost all of them can be addressed very easily with a pair of glasses. According to the World Report on Vision published by the World Health Organization about 2-3 years ago, nearly 2.2 billion people in the world has vision impairment. Out of these, at least half of them could have been prevented or corrected. And 150 plus million are due to uncorrected refractive error. And in India, nearly 10% of all adults above age 30 have uncorrected refractive error. An estimate is uncorrected refractive error magnitude is 85 million in our country. And to that, if we add another 130 to 160 presbyopes, we can imagine the magnitude of the problem that we have in our country. So uncorrected refractive errors has different facets of social impact. Social isolation, impact on education, employment, productivity, quality of life, and also the danger of increased morbidity and resultant economic distress for the people affected and their families. So the impact of uncorrected refractive errors cannot be ignored. And the more recent World Health Assembly and other resolutions are aspiring to achieve a 40% reduction in uncorrected refractive error in the near future. How do we do that? It requires several major areas to be covered. First of all, through eye health promotion and raising the awareness of the problem of uncorrected refractive error, and that indeed it can be corrected, that has to be brought to the attention of the people, public. Second is the recognition of the problem. Third is the correction of the problem through refraction and dispensing. And in addition, in some complex cases of refractive errors, we may have to adopt the techniques of contact lens fitting and refractive surgery. So what is the immediate solution that with what we already have? That is the screening in communities and schools on large scale. And using all the available systems, it is possible that we can begin to blunt this problem of uncorrected refractive error. With focused programs, we can enhance the quantity of people that are addressed. At the same time, we can try and improve the quality of correction of refractive errors. And a very important component of this entire challenge is to supply affordable spectacles for everybody that requires them. And how do we do that? As has already been pointed out by Rajesh, advocacy. Advocacy with all the policymakers. Sometimes it works. If you look at the cataract success story in our country, it happened because of the active involvement of all the three components, the three Ps. Professionals, because they were very interested in doing cataract surgery, excited, because it gives immediate results. And also there is an economic incentive for the professionals in cataract surgery. Second was the policymakers in Indian government for the past 50+ years has been actively supporting prevention of blindness programs. In fact, India was the first one to have a national program for prevention of blindness, control of blindness anywhere in the world, even before there was a cell on blindness in the World Health Organization. Following the World Bank grant in the early 90s, we went ahead, convinced the government, and the government has actually increased the funding for prevention of blindness program. So with policymakers, cataract had a success. And public is very aware of the problem of cataract, and they also know that cataract surgery is quite successful. Two examples of massive screening programs in the recent past were the ones that attracted the attention of the politicians in the states of Telangana and Andhra Pradesh. In fact, they have become an election manifesto. That's a success of advocacy. If we can really get onto the election manifesto of something anywhere in the world, that's a symbol of success with our advocacy efforts. Can we replicate this? Large-scale campaigns which are done on a mission mode. But the mission mode can last only so long. What we have to do is from mission mode, how do we migrate to a sustainability mode? That is something that we have to think of. That means creating the right kind of infrastructure, human resources, and supply of spectacles. We have to build the capacity for optical correction, contact lenses, and refractive surgery. Vision centers have become very popular, and more organizations are developing these centers of primary eye care. And in our country, we require nearly 30,000 of these if we were to really make a huge impact in the long run. And as far as supply chain is concerned about glasses, we have to learn from other businesses. Dr. Alan Foster used to have a slide with an African girl having Coke bottle tops as her earrings. He used to say Coca-Cola could reach her, but we could not reach her. So there are lessons from all these businesses. How do we reach everybody? Even now when we go into the villages in India, anywhere, you see advertisements of all kinds, but there is no advertisement about our healthcare. So how do we learn from all those experiences of the corporate sector? That's very important. Of course, the impending pandemic is myopia. Almost half the world is supposed to become myopic by the year 2050. Can we really wait and let it happen? No. I think we have to make every effort to control it. Atul Gawande in his book Better said, for success in medicine, there are 3 core requirements. Diligence, to do right, and ingenuity. So, in dealing with the problem of uncorrected refractive error, we require all these 3 elements together to be a successful program. So now I would like Pawan to come and make his presentation related